Okay.
Okay, today I'm here with a very good friend of mine, Rick Miller, who is a therapist in Boston, Massachusetts area. Rick is a really talented guy. I've seen him present multiple times at multiple conferences. He's an author, international trainer, speaker, business consultant. He's the author of a couple of books, but one in particular is called Unwrapped, Integrative Therapy with Gay Men. So I want to welcome Rick and his wonderful shirt that he's wearing.
What a way to start. Thank you, Paul. I never know what's going to come out of your mouth.
Yeah, but I really dig your shirt. It looks
Well, I
cool.
have to confess that it's getting its debut today, and I picked it out just for you.
I'm honored, my friend. Well, I thought today we talk a little bit about, excuse me, about working with men and welcoming men into treatment, into therapy.
Great.
And this is a topic I've heard you lecture about, and it's kind of interesting. I was looking over the history of our field, and
Yes.
I noticed that predominantly our field was created by men. And in
Hmm.
the last 20 years, we've seen a shift to where, even though there's some obviously men still in it, hence us, but
Yeah.
it is overwhelmingly nowadays more females. So with that, different changes and shifts, some
Yeah.
good, some not so good, just kind of the way
Yes.
of the universe, a
Yeah.
flow. And so sometimes I think men get kind of lost in therapy in some cases. And I think maybe we can have a little discussion about this. So if you don't mind, could you just kind of start us out with kind of your
Yeah.
views about welcoming men to treatment and certain, how do I say, certain barriers sometimes that men get, not just getting into to therapy, but even while they're in
Yes.
therapy.
Yes. Oh, so many things I want to say. Um, what I have noticed as a gay man going to mental health conferences is that I'm more careful than usual in these professional settings because frequently it's as if I'm the only gay man there, and I'm cautious about being accepted. And so it's interesting that in our field, I've stepped back sometimes 20 years in time when I'm going to these conferences, having these experiences. That's what got me interested in this topic. And what I've observed is that a lot of people think men are dumb, including therapists. And at many conferences, various well-known presenters have been very disparaging towards men, particularly in the field of couples therapy. That when cases are discussed in mental health conferences, usually it's the wife who's wanting more and demanding more of her husband, and the husband is shut down and inaccessible. And these case examples frequently make men look stupid, undesirable, and the tone in the room sometimes is judgmental towards men. And have found myself taking offense to that. I think what's really important is that we need to look at men as they are, to appreciate why they are the way that they are based on the messages that society gives them, the families that they've been raised in, the culture that they've been given messages from, and go from there. And I think that frequently many women don't like men, including therapists. So if a female therapist has a man showing up to her office and she doesn't like him because he's shut down or because he's this or he's chauvinistic or he's that, how is she going to be able to be helpful to him?
Mm-hmm.
So that's how this whole topic came to be. And most clinicians are very empathic and do want to get in there and appreciate why someone has become the way they have become. And I think that men deserve to be treated well by therapists instead of pounced upon because they're causing problems in the relationship. And even if that's true that they're causing problems in the relationship, the way that a therapist is going to be the most helpful is by exploring with him how he's learned to be who he is and why.
Right.
And therapists will be more patient with their clients or patients when they take this approach.
Mhm. You know, it's one thing I think you pointed out at one time when I heard you speak, that it's not always just the female therapists that have a bias about men, it's
Yes.
also male therapists. And
Yes.
I,
Yeah.
I will disclose publicly that I have to catch myself sometimes when I'm dealing with male clients in general, that sometimes my own kind of stuff about being a man, I'm a fairly physical guy. I'm just kind of driven, and I catch myself wanting to say, of course I don't, hey buddy, man up, come on, you're going to be a man, you got to sit here and yell and cry, and and that helps no one.
Well, who knows? With the right people, that would be great. I would
Oh
love
yeah, yeah.
it.
I'm not willing to take the chance, that's
Right,
that
right.
person. But I think that's
Yeah,
a bias that a lot of us men have, as well as in that, particularly us male therapists who maybe are more comfortable or have learned to be more comfortable with emotion,
yeah,
and we just
yeah.
expect other guys, "Oh, come on, you can be a man, and you can also tell about how you feel." And no, you can't from their perspective.
Oh, I would love to lead a workshop with you on masculinity someday and have you enact this type of masculinity, knowing who you really are. And I actually think it would be an incredibly effective way of helping people. So don't rule it out.
Okay.
I wanted to speak about my own awareness of my own masculinity and also the men that I've worked with. So for me, because I was gay and I was closeted until I was, I don't know, 20, 21, until recently, I never felt like I was a real man. I felt like I've been secretive my whole life, that I didn't meet the mold of what a real man is, that I didn't have the strength that I needed to have. And when my first book was published, it forced me to be out there in a different way in the world. And that's when I met you in the world of public speaking. And I realized I needed to allow myself to project who I am instead of hiding. And so the internal experience of not feeling like I was a real man and then learning that indeed I am was a big source of growth for myself. And so in therapy with gay men, I have noticed that many men don't feel as though they're worthy of their masculinity because they're gay. And that's kind of part of where my interest comes from. And then with men who aren't gay, heterosexual men, frequently they feel like they don't measure up or man up to what they're supposed to be. And think about how hard it is for a man to come to therapy. It takes a lot of guts.
Mhm.
And so I really enjoy the process of welcoming men into treatment and aligning with them. You and I are both Ericksonian, and what we've learned to do is to get a read and get a take on who they are and use their own sensibilities in welcoming them in. And that creates a deeper connection and a stronger bond. And that's where a lot of the success comes from in treatment.
Mhm. I'm reminded of a case I heard about where the couple came in, male and female, husband and wife, and the therapist told the husband that he was just not comfortable with the wife's emotion. And if the wife's just got a lot of emotion, if she was if she was Greek or Italian, this would be the way it is, and it's really you that have the problem with emotion. And then they ended up it not working out. And for a long time, this man worked really hard to accept that and do that. And then it turns out that the wife had essentially borderline personality disorder, and
Ah,
her emotion
mhm.
was it was not functional.
Yeah,
And so this guy had internalized this initial
interesting.
thing. So it was later, a lot later in the session, before the therapist figured out, wait, no, this is too much emotion. But
Right,
the initial gut thing was the man's not comfortable, because men aren't comfortable,
right,
as
right.
opposed to the wife, had emotional problems. I mean, that was it. And
Yeah.
nobody's comfortable with that kind of
Well, right.
stuff. So
Sure.
And unfortunately, it wasn't a happy ending, but how do we kind of protect against those biases? All of us. I mean, what are
Right.
your thoughts on that?
Well, as I said earlier, I think it's our responsibility to treat each person coming into our offices as a human being
Mhm.
rather than a category.
Yes.
And that we need, instead of generalizing who they are based on how we categorize them, male, female, ethnic groups, whatever, get to know them and spend time at the beginning uh, finding a way that you can respect the people that you work with. I mean, maybe that's the success of being a decent therapist,
Right.
that instead of judging them for what they've done or who they are, it's our responsibility to look deeply, get to know them, and get to respect who they are.
Right.
And, I know how you work, and of course you do that. And sometimes it feels like we are in love with the people that we work with based on the depth of respect that comes from relating to them on such a profound and deep level.
Mhm.
For me, what I love is helping men feel safe to explore their emotions. And even before they say anything out in the real world, to allow themselves to go into a place of vulnerability, to recognize what they're feeling, why they're feeling what they're feeling, and what it means to them to have feelings. It's so exciting to me to do that. And I've used my own masculinity in a strong way to show people, look, you can be successful, you can be strong, and you can be emotional and communicative. And I think that us being a role model for people is very, very important.
Mhm. Yeah. It's thinking about just men in general in therapy. I think in the same way we also have those same similar stereotypes of women. That they're going to be more emotional or have emotional blockages or whatever it is about emotion.
Yeah.
And I think stereotypes in some ways, they're overgeneralizations. They can sometimes be helpful, but I find it interesting that when I talk to people and say men aren't emotional, they miss the times when men get angry, because last time I heard anger is an emotion. Uh, they miss the time that quiet long drive back from the football game. The
Mhm.
guys are in the car.
Yeah,
I know firsthand. There's a lot of sharing going on. A beer or two, and
that's right.
yeah,
Right.
yeah. Denise
So,
and I aren't really sleeping in the same bed anymore. And oh, really? And
right. Men share in their settings and in their ways, and they're
right.
saying a lot.
Mhm. Yeah.
Yeah.
So I guess that's the trick, is how do we facilitate the feeling of those settings in our offices? And for me, that's kind of tricky.
And I think it's a dance of sorts, and it's delicate. That what we need to do is respect who the people are that are coming into our offices. And if you're getting a man that's fairly protective or fairly defended, there's no point in yanking him open. You're just going to lose him immediately. We have to gently get in there with him and form a relationship and form an alliance. And Jeff Zeig is one of my mentors. And I love how he finds similarities between the people that he's working with and has these conversations about life that may not even feel therapeutic. But there is absolutely something strong happening, which is that he's creating an alliance and invoking trust with the people that he works with. And I do the same. So I actually have two practices. I have a practice in Boston, and then I also have a practice in Cape Cod in Truro, which is a very small town. And working in a small town, as you probably appreciate, is different in terms of how we present ourselves, the boundaries that we have, what we share about ourselves. I have a home office, so
Mhm.
people see a lot of things about my life. And so I have really touching conversations about the weather,
Yeah.
about the garden, about my dog,
Right.
about my car, you name it. And those have proved successful in the world of relational psychotherapy.
Yeah.
And sometimes I think my biggest success is that I like people and that I like to converse with people and I like to have fun with people.
Yeah.
So humor, I mean, I don't know how much humor you bring into your office. You certainly bring it into the outside world. It's so effective. And if you're working with men who are fearful of being judged or being pounced on, and you can use humor lightly to make a point, that's fantastic. It's the best gift, the
Yeah.
best clinical gift.
Right. Yeah. And we are often taught, and again, it's been many years since I was in school, but about limiting self-disclosure, and
Yeah,
almost it became a taboo.
yeah,
But I think in calculated self-disclosure to any client, I mean, within reason, is definitely that bridging, because to even talk about your garden, that's self-disclosure.
yeah, yeah.
You probably have gotten well, how long you been married, or this has nothing to do with them. But
Right.
if we go, I noticed that you've redirected this back to me. I mean, you've totally lost rapport. Why not just say, oh, I'm divorced, or I've never been married? And then if they have a problem with that, have that dialogue about it
Yeah,
rather than just
yeah,
trying to hide um, that. And particularly, I think men too, and again, I'm overgeneralizing, we have a protective and it may be due from an evolutionary biologist think about being the alpha to being the protector, the provider, in control. We are naturally maybe a little more skeptical, or a little more, well, let's see, what's this girl
yeah,
got going
yeah.
on here? And I
Hmm.
think being open, like it sounds like you are, to those kind of interactions, I think only helps foster the trust.
Well, it's funny. I did want to go back to self-disclosure, but what you just said strikes a chord again, being a gay man, because I've always worried over the years when I get certain men coming into my office that aren't gay, how are they going to deal with me? What are they going to think about me? And a colleague in the last few years referred a man that she could no longer work with because, well, because of all the things we're talking about today. So she referred him to me, and I said to her, how is he going to deal with my being gay? She said, well, he's probably going to comment on whatever it is that you're wearing and your shoes, and say something to me about that. And I have no idea if that ever happened. And we've been working together for 2 or 3 years. So clearly it's worked. But frequently I find myself wondering, oh my God, what are they going to think about me? And when they Google me and they see that I've written books about working with gay men, are they going to want to work with me? And for the most part, it's been great. I do remember once that I had a male physician, older guy, referred to me. He walked into my office once, never came back, and I knew that I didn't make the cut for a variety of reasons, part of which was that I wasn't the man that he wanted to work with.
Right.
And that's fine, totally fine. You were talking about self-disclosure, and I was having a conversation. I teach medical students at Harvard, psychiatric residents, about group psychotherapy, and we got onto the conversation yesterday about self-disclosure, and they said to me, this is my second time that I've been teaching them, it's week 2 online. They said, thank you so much for revealing so much of yourself with us. They said, it's fascinating. And I said, you're absolutely welcome. I love doing it. And it made me think about the subculture in Boston, Massachusetts, whether it be Harvard Medical School or the psychoanalytic community. I
Mhm.
grew up in the psychodynamic community. We were taught not to have any personalities, as
Yeah.
far as I'm concerned.
Yeah.
And I basically hid in my office with the door closed, using humor, using my personality, having fun, and not telling other clinicians or supervisors what I was doing. And I was saying to these residents the other day, my biggest regret is that I didn't come to this place of security sooner, where I could have been the man that I am openly in the field of mental health. And I am so grateful to have met you and to meet many of the people that we've hung out with, because it's really been amazing to form alliances with men in our field, have fun, and be accepted. So I'm excited about that.
And the fact that many of us have totally different geographic locations,
Yeah,
different backgrounds, I'm sure political, religious beliefs, and that not everyone, but most of us can kind of set those, which I think are really small things, aside.
Yeah.
And essentially, that's what we're doing with our clients as
Yeah.
well.
Yes.
You know, it's kind of like you're talking about religion. If somebody comes in and they're a very strong religious person, and we're not, or vice versa, it's that
Right.
same kind of thing. How do we welcome that and use
Yeah.
that as a resource? So if
Yes.
we see a stereotypical man, stubborn view of hierarchy in a relationship, how do we use that as a resource? How do we welcome that? It doesn't
Yes.
mean approve. I think that's when I say welcome, some people have said, well, you're approving of that, where he's trying or she's trying to. No, we're just welcoming it, to
Yes.
say it's not a taboo thing to talk about, and that you're
Yeah.
not a bad person to feel that way. And I think that's so important.
And we are living in such odd times now between COVID and Black Lives Matter, and I keep thinking about the role of men recently, and how society needs a redo about how men are viewed and understood. And men that have misused their power aren't going to change like that. They need to come into our offices and be appreciated for who they are,
Mhm.
and explore in a non-judgmental way how they've learned to misuse their power and how they can act differently. And maybe that means imagining with them, if their daughter were treated this way, how they would feel.
Right.
Any number of ways. And that's the patience, and that's the welcoming that I'm talking about. Men need to be respected and treated well for who they are, because it's the world that they've grown up with. It's the world that they know. Now, many feminists might get really pissed hearing this, but the only way that we can make changes is by getting in there with them. I was working yesterday with a female client, and she has been struggling with her partner. They've lived together 18 years, and I frequently offer her, as she said to me, the male viewpoint. And it's been so helpful for her, for me to decipher what may be going on for him. And she said, my last two therapists were feminists, and they were always indirectly giving me the message that I shouldn't be with him and I shouldn't be with him. And she said, you're just helping me understand how men think, which is great. I'm happy to do that. The other part of the truth is her relationship has grown tremendously with her partner. So I happen to be working with her at a moment in time where I can appreciate things and point that out about him that wouldn't have been the case 20 years ago. So for whatever it's worth.
Right. And you know, it's something that occurred to me is the idea of also younger men now, young
Yes.
men in their 20s who have grown up in a much different
Totally.
environment
Yeah.
than you and I did. And
Yes.
a lot of times they have been rather, and this is just my word, kind of emasculated because they don't know how to act, because you can't say certain things that just 10, 20 years ago you can. And sometimes that's a good thing,
Yeah.
but
Yeah.
it's a very confusing time for a lot of these young people. Now, funny story, I brought this up to my dad, who's a great dad, but he's an old Marine. So his answer for everything is, well, going to Paris Island, that take care of everything, because that's how you did it, in 1964, but now walking that how do you be a masculine man, a protector, a provider, if that's your thing, but
Right.
also have that openness to the sensitivity that we are cultivating more, at least I think, in
Yes.
our conversations in society.
Well, it's funny that you use the word emasculated, because in a traditional sense it is emasculated, and in a newer sense it's more masculine. And I've done some writing and some thinking about this a lot, that the notion of masculinity needs to be more rounded so that men can be more expressive, more communicative, more attuned. I often joke, but also in seriousness, think that if we could get retreats of men together, gay men, straight men, they can learn from each other.
Mm-hmm.
So the gay men can learn about owning power and strength. and the straight men can learn about owning sensitivity and softness and maybe style too. The world is changing vastly, and we're talking about, or I'm talking about, gay men and straight men, but gender is changing so much. It's hard to keep up with, and the whole world of masculinity is shifting and changing as non-conforming genders is becoming more of a big thing, and that's a challenge too. So
Yeah.
it's exciting.
Yeah, and I think it also goes back to who's making these distinctions. Because when we say masculine, you and I will have a different opinion
Totally.
between us.
Yeah.
But then collectively, we will have a more probably aligned opinion than somebody who a man who's 22,
That's right.
or 65 or 80.
Yeah.
You know,
Yeah.
and so we forget, and this is just a social constructionist and me talking. We
Yeah.
forget that all this, and again, I'm not talking about sexuality. I'm talking
Yeah.
about just the idea, the character traits
Yeah.
of gender are
Yeah.
very fluid.
Yes.
And but at the same time, I think, and it's a natural thing, we all want everyone to be like we are.
Yeah. Right.
And that if we're a therapist and we're going like, and if we're a man and like, I think man ought to be this way, and they're not, and then we instantly start thinking that's bad. And the same kind of thing, I'm sure, happens in any setting.
Yes.
But
Yeah.
I think since we're talking about men, I'm really glad that there are at least some avenues to maybe give a therapist to pause for a minute and say, what am I not welcoming in? Or how are my views of gender, even though they might not be wrong, but could I be more flexible?
Right. Or if I don't like this particular kind of man and he walks in my office,
Right.
what do I do? Or if I've had a difficult relationship with a man and I'm a divorced woman, and the kind of man that I divorced walks into my office.
Boy, don't they? Have you ever noticed that whatever you're going through, that's the clients that's going to show up?
Exactly. Yes.
So,
right. Totally.
Well, we probably could talk about this for several hours, but I just want to give a little taste to people, and I think this deserves maybe a part 2.
Yeah, I would love to do that. Yes. Yeah.
Because I think everything that you're saying, man, is gold, and I really appreciate you bringing it up. And what's interesting to me is the last time I heard you speak about this topic, I think I was the only guy in the room.
And there was one other person, maybe 2 others, but yeah.
Yeah, they were hiding and trying to get out because they're like,
get me out of this place.
Yeah.
But it was so funny because some of the women in the room were dying, like loving what I had to say, or like thinking about things for the very first time. Right. It's like, what?
Yeah. And that's good. And that gets the dialogue going. So,
yeah. Anyway. Well, I always love talking to you. It's always great to see you.
Well, it's always my pleasure. Thanks for talking to me today.
Thank you. Take care.
All right.